My name is Kwabena Chenchen. Many thanks for joining us here on News Desk. Now, Amnesty International Ghana has raised concerns with the 100% increase in death sentences in the country over a one-year period. According to the director of the Human Rights Organization, Lawrence Amesu, the upsurge is a detriment to the abolishment of the death penalty in the country. Well, we are unable to bring you that particular sound clip. We'll try and rectify the situation and bring it to you a bit later on. But let's now head to the Kolebu Teaching Hospital, where we are told that some senior staff of the hospital are getting ready to embark on a protest following the dismissal of the association's president, Dr. Charles Ofe-Palm. Management of the Kolebu Teaching Hospital allegedly handed a dismissal letter to the president of the Senior Staff Association of the hospital, Dr. Charles Ofe-Palm, yesterday. But Dr. Palm insists he is still at post and will not recognize his supposed dismissal because due process was not followed. Now, tensions between the Kolebu Senior Staff Association and management of the hospital have risen for the past weeks after the association accused the board and management of maladministration. We'll be bringing you some reactions to this developing story in a short while, but let's first take you through the scenario and how it has gotten to this very point. Matilda Pomega of our health desk is joining me now over the telephone lines to take us through the entire process from the comments allegedly passed by Dr. Ofe in a radio interview through to his interdiction and supposed dismissal. So Matilda is making some checks anyway, but she's now joining us over the phone lines now with some more so far. So, Matilda, many thanks for joining us. So, take us through really how the situation got to this point. Give us the background to this issue.
Okay, so Chenchen, as we all know that Kolebu, there's been a lot of issues that have been there for a number of years now. You know, the Senior Staff Association somewhere last year started raising concerns over management about the way they were handling administration at the hospital. And they cited mismanagement of the internally generated funds and the whole misappropriation of funds at the hospital. So this is where the whole thing started, where these the Association of Senior Workers at Kolebu were raising this concern. So that was when they started calling for the removal of the CEO. Which is Dr. Bakho. Somewhere last 2 years too, they staged the same concerns, and Reverend Okuti was removed from his office, and Dr. Gilbert Bakho was made to replace him. And so last year, we didn't hear anything from them before the last quarter of last year, 2015, where they started raising some of these concerns again. And as we speak now, you know, there's an injunction already in court where they are asking that no action should be taken against this Senior Staff Association. But somewhere last month, we got information that this association, that is the Kolebu Senior Staff Association, had secured this injunction, and they are still in court, and they are not supposed to be discussing this matters at management meeting. But we do not know the state of this case yet. The last time we heard it was the case was adjourned to 2 weeks' time. And so last week we heard the president of the Senior Staff Association was interdicted. That is Ofe-Palm. We do not know exactly what triggered it, but what management gave us an excuse for his interdiction was because he had made certain comments which were not, which were false, and that's according to the management. So based on some of these comments, based on their policy at the hospital, they interdicted him, which involved him not be able to speak as the president of the COSA, and also his salary was also halved as well. So yesterday we got information again that this president of the Senior Staff Association was again given his letter that he has been sacked from the institution. I'm yet to get a copy of that letter, but I am told he has already received that letter somewhere last night. But before that, the Senior Staff Association, there was a suit, there was supposed to be an injunction which was filed by Charles of Palm, which was presented to the management at 2 p.m. We do not know what exactly has triggered this, but the management went ahead and gave him his letter that he has been dismissed from the hospital. I'm still trying my contacts to get reasons as to what has triggered management to give him this letter to sack him from the hospital. So I'm still trying my contacts to get a copy of this letter to share with the people out there. And then we'll be getting more details on that.
Right, a comprehensive detail you just gave us there, Matilda. But just to also ask, we were picking indication that an injunction was being sought on this particular issue. I'm speaking of this supposed dismissal. Is that really the case?
Yes, an injunction was secured at the High Court yesterday at 2 p.m., which was filed by Charles of Palm in his capacity as the president of the Kolebu Association, which also involved the Kolebu Teaching Hospital and the board of the Kolebu Teaching Hospital as well. And the motion of notice was application for redress under Article 33 of the 1992 Constitution. And this was supposed to take immediate effect yesterday, but we don't know exactly what has triggered this, why management overlooked this injunction and then went ahead to issue this letter to him. So we are still trying to get more answers to what exactly has triggered this decision by the management.
Okay. Finally, before you go, Matilda, the latest information we have on this, I mean, just before coming on air, was the fact that Dr. Charles of Palm insists he's still at post and will not recognize that very letter seeking to dismiss him from that very position. And he says due process was not followed, so he's not going to stick to the directive in that particular letter. Do we, for instance, know whether he showed up at work? Do we know what's going on now at the Kolebu Teaching Hospital?
For now, he's not at work. I got my sources to confirm to me that he has not reported this morning to work, and I'm told they are going into some crunch meeting, the Senior Staff Association, whether it's going to be a strike or a demonstration in protest over this action that has been taken by management. We do not know yet, but what I gathered is that he has not reported to work this morning, Ginger.
Right. Matilda, many thanks for your time on News Desk this morning. That was my colleague with our health desk, Matilda Pomega, bringing us the very latest on that very story. And I'm speaking of Dr. Charles of Palm, who is the president of the Kolebu Senior Staff Association, whom we are told has been suspended. Well, he was suspended earlier, but this morning the information we have is that he has been dismissed by management of the hospital for allegedly going contrary to the hospital's laid down rules. And we'll be keeping our eyes on this because you're also picking indication that some members of the Senior Staff Association are threatening a demonstration. I don't know whether that's going to happen today or tomorrow, but we are still keeping tabs on this very situation. We'll bring you the very latest as soon as we have that information. But let's now turn our attention to some health matters. And as Ghana joins the world in marking World Health Day today, health experts in the country are calling for a collaborative effort in educating the populace on the early detection and treatments of diabetes. A director at the WHO Collaborating Center for Advocacy and Training in Pharmacovigilance, Professor Alex Dodu, and a family physician specialist, Dr. Ebenezer Odru-Mensah, are calling on the relevant agencies to do more in addressing the alarming number of deaths being recorded as a result of diabetes. This, they believe, should be done through massive education about the disease and regular diabetes tests on the parts of every individual. The two were speaking earlier on the AM show.
There were 500,000 Ghanaians, and that is expected to be 1 million in the next few years. So even 1 million out of 25 million. But I think the most authoritative put it around 7%, 8% in 2012. So if you project, it's fair to say that roughly anywhere between 8 and 12% of Ghanaians, roughly 1 in 10, has diabetes. But the sad thing is that they don't know. Policy actions, I think in Ghana we all know what happens. Things we don't kill us in big numbers and don't kill us spectacularly, they just pass. But Doc described it, and I have seen it from friends, family members, amputations, blindness. I mean, it's all over the place. And to the extent that we allow that to happen, for me, it is sad. People don't know they have it. That is the biggest problem. And it looks like we don't even care. And because it's not politics, we don't talk about it because, yeah, people are dying. I mean, if you calculate he said in light, it's a big problem. If you look at Konfandochi, it forms definitely one of the top 10 causes of death. The same for Kolebu. And it is a fact that in the next 10 years, diabetes, together with high blood pressure and public cancer, will kill us more than AIDS, malaria, TB, and all the communities. So whichever way we look at it, we have a problem coming. We can do the usual Ghanaian thing and say it doesn't matter and we all die, or we can wake up and smell the coffee. I think to the layperson, simply type 1 is the one that in the old days we used to call it insulin dependence. You are born, you don't even have insulin, so you generally tend to you need insulin injections. And usually you have it from birth. And type 2 is the one, in the good old days, it was called maturity onset. As you grow older, you have it. And that's what doctor is saying, that forms 90%. So those who need insulin injections, I mean, you know it usually from birth, you have difficulties and you are diagnosed with diabetes and you need those injections throughout your life usually. So that is the main difference. And of course, in a lot of countries, and you made mention of a policy issue in several developed countries when you have type 1. Because you are born with it, you need insulin, if you don't have it, you die. The state finds a way of looking after you for life. Insofar as the diabetes is concerned, because insulin is expensive. It must be kept in the fridge. You need needles. You need to check your sugar. It's a whole ritual. And even in some countries, type 2, once you are diagnosed with type 2 diabetes, government tries to see whether they can manage it. So, one, is a huge burden. It's a big cost to the individual. Managing diabetes appropriately is expensive. It is not cheap. You have to buy medicines. You have to buy those things, Lancers to check your blood sugar. Ideally, you need a glucose meter at home so that you can do it yourself. You got to be trained if you are taking insulin, how to inject yourself, and if cost becomes an issue. So diabetes actually is also a very, very well-known cause of poverty, and it affects poor people as well. Middle class, but it also affects poor people, and the poor are doubly affected. And for the one which affects 90% of the population, it tends to affect those in the productive years of their life. So here you are, you need to work, you have diabetes, you need to spend money, and if you go to the hospital too much, you don't get the money for the work, then you are in a cycle, and this is where you need state intervention. I am pleased that Multi TV has taken this up. I hope other stations will on this World Health Day and beyond, but if we joke with it, that will be our undoing. And I thought I would do the history on diabetes, because even this call by the World Health Organization today was made way back in 2011 at the United Nations. The UN never deals with health issues. But in 2011 September, they met and said, look, we have a crisis. The only time the UN has met on these things was HIV/AIDS way back. Now, if they are putting this thing in the same category in terms of the numbers of people to be affected and its impact on the world, then there's a problem. So in September, the United Nations itself, the WHO is a health agency for the UN, but the agency itself met and said, look, we are in trouble, diabetes, high blood pressure, and we must do something. 5 years down the line, WHO has come again. And for me, the question we ask is, between now and then, what have we done and what are we doing?
On issues relating to World Health Day, and the multimedia group Sugar Project is organizing a free screening exercise for people in Kumasi to mark the day. Physician specialist Nana Hamabans, who's with the team, says the disease becomes deadly when people don't seek early treatment after diagnosis. Right. So we're bringing you that very soundbite in a brief while, but let's now go onto the phone lines and speak to my colleague Evans Mensah, who's with the team. Mind you, we are also having the Joy ballot box also in the Ashanti region today and tomorrow. So let's go over to the phone lines now and get some more from Evans Mensah, who's with the team there. So Evans, good morning. Thanks for joining us. So can you tell us really how the Sugar Project has panned out so far, and then you can build up to the Joy ballot box?
Yeah, the Sugar Project has started well. Today is World Health Day, as you know, and the theme of the World Health Day is beat diabetes. So it's something that, of course, is raising awareness, but also getting people to freely screen, get medical advice as to what to do, and they also hand them over to the local health facility. We have one screening going on here at the KNUST campus. There are more than 5 more other places spread across the Ashanti region where, the local residents, community people are getting free screening today. It's an exciting thing for all of the residents here who get to have these free screening.
Right. So let's now talk about the Joy ballot box and what to expect today and tomorrow, particularly for the many people who reside in the Ashanti regional capital, Kumasi.
Well, it's the expectation. It's pretty high. A lot of people have followed what happened in the central region, and so that has whipped up a lot of enthusiasm as far as this is concerned. Already today, we've run out of ballot papers. We have to look for more. The ballot boxes are already getting full. People are participating in their numbers, writing down their issues, anticipating that tomorrow evening between 5:30 and 7, they can get to put those questions to their candidates who will join us live from the KMUC campus with the Joy Ballot Box Show live interaction. So it's been exciting. The other ballot boxes that we are distributing to this morning to Astawase, to other places across the region to get as many views as possible as far as the dominant issues are concerned.
Right. Many thanks for your time, Evans Mensah on News Desk, and I will be coming to you for a lot more on the Joy ballot box and indeed the sugar project a bit later on. That was Evans Mensah of our political desk here at Joy News, telling us a lot more about what is currently going on there. And if you do not know, the Joy ballot box will be hitting your region any moment from now. Our first destination was the central region, and we are now in the Ashanti region. Tomorrow we'll be bringing you a live feed of what goes on there as well. But let's still stay with the health issues we were speaking of earlier, and we can now take a listen to a physician specialist, Nana Ama-Barnes, who's saying a lot more about diabetes, the need for early diagnosis and treatment.
Diabetes is deadly when you don't know your status and you have it and you don't manage it properly. That's when the complications such as blindness, amputation, kidney failure, and maybe resultant death may come in. So it's only deadly when you are not able to manage it properly or you don't know your status and you are not living right. Today is World Health Day. The theme is Beat Diabetes. So here in Kumasi, we are screening, giving people an opportunity to screen for diabetes and hypertension. Free medical screening at various centers scattered throughout Kumasi, just for them to be able to know their status in diabetes. Once they know their status, they'll be able to work towards it. And even if they don't have diabetes, they live healthy to avoid diabetes also. Today we are going to Menshia, we are going to the KNUST, we are going to New Tafo, we are going to do free screening for them. So we encourage anybody who will be anywhere in the vicinities to come and have free screening for diabetes so that they know their status.
So what happens when you realize that after testing the person, you realize the person has diabetes? What happens then? What
we do is that we have a referral system. So we will refer you to, you'll be in the vicinity of the hospital. So we refer you to the medical team in the hospital and they will take up your management and follow up. So it's almost like a one-stop shop. Once you're diagnosed, once you have any problems, you go to the health center for follow-up.
What's been the response to the sugar project?
It's been amazing. I mean, in Cape Coast, in the central region, we saved quite a number of lives, and people are so grateful for this opportunity. So, I mean, it's something free. Why not come and get tested? People are happy about it, and they are ready to support our initiative.
So with the alarming statistics that 8 out of 12 persons in the country are diagnosed with diabetes, the question we're asking this morning is what really you know about the disease and whether or not you even know your status. We've been finding out from quite a number of people here on the streets of Accra.
It's a disease that is caused by the lack of insulin or the body's unresponsiveness to insulin being produced, resulting in excess sugar staying in the blood. We can do a lot with our diet. We can do a lot with regular medical checkups. And then those who are already diabetic, unfortunately, some are born with it. We have different types. Type 1, type 2, and then those who get it when they are pregnant, called it gestational diabetes. So it depends on which type you have. If you have type 1, it's difficult controlling it with diet. Basically, you have to be on insulin because it's caused by the lack of insulin. If you have type 2, maybe you had it as a result of your lifestyle, then lifestyle changes will help a lot, particularly your diet and being on regular medication. If it's gestational, you are pregnant and as a result your blood sugar level goes up. Basically, after delivery, we expect that things will normalize.
Diabetes is a sickness that is from, like, when you like taking sugar, a lot of sugar, it gives you, like, it will form a sore in you, and when it's too much it comes out. That's the little I know about it, but I don't know much. How to prevent it is just you not take much. You have to limit the way you take your sugar.
Diabetes, a disease that can kill so easily, and it's dangerous too. So, eating of sugar, and then there's a lot of fat. Just control your diet, visit the hospital on time, and doing checkups.
You have to limit the sugar intake in case when it comes out, it can even cut your leg or something like that.
How does it come out to cut your leg?
It comes out like a sore. When it comes out, there's no treatment for it, so it can even cut your leg or your hand or something like that. By preventing it, you have to limit your sugar intake in it.
What I know about diabetes is about too much eating of sugar, and then a lot of drinks. When you drink too much alcohol and other varieties, so that one man have to control.
Normally it comes about when you take in sugar, a lot of sugar, but the sugar is not only limited to the normal sugar we take. It comes about in taking foods that contain sugar, rice. There are some kinds of food that you even take that can cause that. But one thing you have to know is that you have to watch your diet. Eating a lot of unwhole meals can cause diabetes. If you don't exercise also a lot, it's more prevalent in men. One of the symptoms is you urinate a lot, you start to sweat a lot, you want to drink a lot of water. So when something like that happens, it's better you go and see your doctor and find out exactly what is happening. And I know it can also even lead to stroke.
When your blood sugar goes up, we don't really know what causes it. But we know that diet and then lifestyle issues are involved, as well as hereditary issues. So if you have a family history of it, you are at a higher risk of, being diagnosed later in life than somebody who hasn't got a family history of it. I would advise the general public, go check your blood sugar levels, check your body weight, check your diet, check your lifestyle. If you live a very sedentary kind of lifestyle, you are not exercising your body enough and all of that, it makes you prone. And then also, if you have a family history of it, then you should be more conscious. So you go to see your GP and then have your blood sugar levels regularly, monitored. And that would be of very good use, yeah.
So it appears quite a number of people we spoke to appear to know what really diabetes is, and they have a lot more information on that disease. Will be bringing a lot more reactions subsequently. But we're taking a break here on News, but do stay on because we'll be returning to a particular story in the NPP. And you do know that the party is rejecting claims that it is considering the reinstatement of two suspended national executives. I'm speaking of Mr. Paul Afoko and the General Secretary Kwabena Ejapong. Stay with us because there's also been a response from the camp of Mr. Paul Afoko. We'll be bringing all that to you after this break.